I think it's important, as always, that we keep our eye on the data with this. And we've talked about, since we started the reopening process, looking at hospital capacity. And that is the driver that caused us to decide that we needed to move forward with a mask ordinance. We've largely, I think Dr. Dart and I have been at these, and Commissioner Keith as well, have been at these for months now, talking about the importance of wearing a mask. But it was never, we didn't get to the point where it was felt that it needed to be mandated until we heard from our hospitals and they told us, we're getting to a point where this has to happen. And so I just want to put things in context here. You know, when we started out the reopening process in early May, we had, I believe it was 14 people on May 9th in Tulsa County hospitals with COVID-19. Earlier this week, we had 185. That is the type of change that we're seeing and have seen just in a 2-month period of time here in our city, in about 10 weeks, relative to this event. And that's why it became necessary for us to take this kind of action to slow the spread of this virus. On the 21st of July, Tulsa County reached a milestone in that 1% of all residents of our county had at that point tested positive for COVID-19. The United States as a whole reached that milestone on the 13th of July. I cannot think of a time in the history of our city where 1% of our population was diagnosed with an infectious disease in a 6-month period of time from its origin. It's a remarkable rate of spread, and again, why we are encouraging the social distancing practices that we've encouraged, why we're enforcing the state guidelines around how businesses should operate, and why we felt it was necessary to put in place a mask ordinance.